Bolo, and this is my colleague Nurse Style. Today we will be dealing with a bedridden patient that is diabetic. We will be conducting a skin assessment, giving her a sponge bath, and also checking her mouth, her feet, and her skin for anything that's not supposed to be there. Also, the room is already cleaned and sterilized. Now we will go into getting ready, putting on our PPE. First, we will wash our hands. So you rub your hands through the fingers, the palm, the wrist, after wetting it.
Okay.
Rinse your hands thoroughly. Make sure all soap is off. Then you take up a clean hand towel, wipe, dry thoroughly. Use the same hand towel you used to dry your hand to turn off the pipe. After which you throw the hand towel in the bin. So first you're going to take your soap. So lather the soap. You're going to perform your hand washing techniques by interlocking the fingers and rubbing. Here, take your towel, open it, right. You will take the hand towel to close lock off the pipe and then discard. So we're going to put on our PPE right now. Now we will be putting on our we will be assisting each other as colleagues. The PPE have something in here, so when we're given the sponge bath, we don't get wet, or uniforms don't get wet. Then we should put on our head mask so that the hair does not come in contact with the patient. After which we'll put on our mask. Then as you can see, we're going to put on our gloves. The edges of the gloves are cold to prevent contamination. You hold the inside and put your finger in. Use the gloves that's already on your finger. Take off the other glove. Being that this part is already around, very nice.
Yes.
So you
To
don't
help my other arm.
Yeah, so you don't contaminate. So we have on our PPEs. Now we are going to enter the room where our patient is. Good morning, Good morning.
Good morning.
So we're checking to see if there is any hazard in the room, even though it has been cleaned already,
And we're also checking the bed.
to see if everything is intact and if the patient is in the middle and safe. So good morning. My name is Nimoy Bogo and this is my colleague.
Nurse time.
Today we'll be your nurses. We will be giving you a sponge bath, assessing your skin, your mouth, and your feet to see that everything is intact and okay, alright? After which we will be taking a glycometer GMR test, which is a blood sugar test, a little bit of lifting up, nothing major, and then give you something to eat. So how was your night? Alright, you're feeling well? Alright then, so I'll prepare this stuff to be with you. I'll be right back.
So you're doing okay? Was the nurse yesterday good with you? How was your stay here? How have it been? Why? None of it? Okay. So soon we'll finish with you, so I just want to take this one quick and fast, alright?
Alright, first we will be cleaning the mouth to see if the hygiene in the mouth is okay and if there's no bacteria, no breakouts, just to see that you're on the right track, alright? So we know that you can help yourself a little and we want to give you as much independence as possible. So we're going to help
Assist you
you.
up. Come on. Alright.
Mm.
Give me a second.
So the toothbrush already has all the toothpaste. Here you go. Thank you. There's some water.
Alright. Mask need to lay back down.
Alright. So now, after having the mouth checked and hygiene, so we're gonna ask her a little open the mouth to see if we can see anything. Is it okay for us to touch you?
Yes.
Alright, everything seems to be intact. We are going to clean the eyes, the ears, the face.
So when you're cleaning the eyes, you have to go in and right out. So I'm gonna ask you to close the eyes for me. In, right out. You're gonna fold it for the other eye. You go in and then out. This is going to be internally.
After doing the eyes, you move on to the ears. So I'm going to turn your head a little. Clean the ears thoroughly. Check if there is anything behind there, any moisture, any breakout, any redness. And you turn the cloth over and do the same thing for the other ear.
Turn this corner.
After doing that, you will see that she can help herself a little more to give her as much independence. So we'll ask her to wipe her face, clean her face. So Miss Kadeem is going to ask you to clean your face.
Give her to this corner. So now we're going to clean the body.
Before doing the body, we're also going to clean the neck. And we're going to lift her a little to check the back of her neck to see if there is any redness, breaking nose, or anything. Check the neck. Alright, then everything is intact.
So put her back down.
Lay her back down so you can- It only starts on the body. So first we clean the hands and then the tummy and the chest. So
while doing cleaning the patient's body, we're checking to see if there is any redness or swollenness, or if there is maybe be a breakout on the patient's skin due to the pressure point
You should also check the arm and the elbows.
Is this part?
We discard off for every area we use a new sanitized cloth. First, then we do the chest, the tummy. The area here, you do the foots first. You don't touch this area. You do the foots first. So when you're at the foot, you check between each toe to see if there is any moisture. Check underneath the toe to see if there is any moisture. Lift the foot.
Yes. And also check the fingernails, the toenails, because sometimes they might have an infection.
Alright. So after doing that, we are going to sanitize our hands.
Already being cleaned and closed. So now we're going to apply some moisturizer to prevent any skin ulcers and skin cracks, because diabetic patients tend to have it, so you want to moisturize them or lotion them.
And it is a prescribed cream, because every diabetic patient uses a different prescribed cream.
Thank you. Perfect.
After doing all of that, because she's a bedridden patient, you're going to lift her to side, just to ease her. It depends on the size of the patient. So first, you're going to fold the hand, then lift her one hand on the chest, one below the buttocks.
And also, when doing this, you check the pressure point to see if there's any moisture. If the moisture level is very high, that will be an indication that a bed sore might be coming. So you check the pressure points, being that there's nothing there, you put her back down comfortably.
And do the same
not being
thing.
rough.
Do the same thing to the other side. You do the same checks. Put her back down comfortably. So, Miss Green, we will be conducting a GMRX test on you. So, first, the things are already sterilized from the last nurse that used it. The needle is already in. You're going to cover it, gauge it, pull it back to see if it's intact.
Okay.
Rest it back here. These are sterilized cottons. Get the tear one, throw it in the bin. And then you're going to clean the area of the finger that is going to be sticked. Then to dispose of that. So how are you today? You fine?
Okay. It's going to trick you a little bit, but it's going to be okay.
Massage the finger.
Quick and easy. Okay.
Alright.
See that? Finished already.
Yeah man, nothing much. Then you insert the strip and then Alright, so it is reading 6.5, which is relatively normal. You dispose of the strip, after which you give the patient a sterilized cotton to hold down on the finger. Sterilize, show it is. Then clean the materials needed that you use for persons coming.
For
Take
future,
out,
future use.
yes, for future use, and you take out the needle and throw it in the thing that a needle is supposed to be thrown in. Alright, you record it.
Yeah.
So the date and the time, and it's 6.5.
Yeah. And
Okay.
patient mark.
Alright then, how are you feeling? You alright now? So after this, now we're going to offer you some breakfast, alright? So we'll be right back.
Thank you. Hope you enjoy. And remember to keep safe and follow all COVID-19 protocols.
Eating well, save lives.
Thank you.